Good morning. Wonderful. This meeting of the Berry County Board of Commissioners is called to order. Will commissioners, staff, and guests please rise for the invocation, followed by the Pledge of Allegiance. Dear Heavenly Father, thank you for bringing us here today. Lord, we just ask that you be with those members that are absent and dealing with personal issues. Help them to be at peace and help us to consider the issues for our community and our county with wisdom, and be with those men and women who are serving in harm's way to afford us these freedoms. In Jesus' name, amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. For the purposes of attendance, the clerk will call the roll.
Connor, absent. Geiger,
Here and on time.
Gibson,
Here.
Jackson, Parker, Smelker, Wing.
Here. Thank you, ma'am. Approval of the written agenda. At this time, any commissioner or member of the public may ask for an item to be removed from the consent agenda and placed under items for consideration. Hearing no such request, and without objection, the agenda is approved as written. Reports from state and county officers. Does any state or county officer or their representative have a report to share with the board? Good morning.
Morning, everyone. I'm Colette Scrimter, Health Officer for the Berry.
Can you talk closer to the mic?
Sorry.
Thank you.
I'm the Health Officer for Berry Eaton District Health Department. I have with me today Ann Barna, our Planning Director, and Jennifer Kazaraz, our Emergency Preparedness Coordinator. And we're just going to give you an update on what's going on with COVID-19. I'm going to start things out by turning it over to Ann so she can talk data. And then Jen and I will be available to answer questions you might have regarding what's going on in the community.
Okay, so I don't know if it's possible to zoom in a little bit. Okay, great. So if you scroll down to the first chart, what you'll notice is the blue line there is Berry County cases, both new, confirmed, and probable cases, and that's a rate. So that is a rate per million people. So obviously there's not a million people in Berry County, but it helps us to compare what's going on in Berry County compared to Eaton County or even the state of Michigan as a whole. So right now, I'm sure you're aware, we're seeing an increase in COVID-19 cases across the country. And really, we're seeing that happen in rural and suburban areas as opposed to the first wave where it really was concentrated in urban areas. So you see the blue line is Berry and the red line is Eaton. So beginning the end of September, really, we started seeing a really rapid increase in COVID-19 cases in Berry County residents. So right now, that rate of 308 cases per million means that we have a higher rate than almost any other region in Michigan right now, except for the UP, which is having a very bad outbreak because of Wisconsin. Okay, go ahead and scroll down. So this is the actual number of cases. So as before, the chart was a rate. This is the actual number of cases for Berry County residents. So as you can see, we're getting anywhere from 15 to 25 new cases of COVID-19 in Berry County residents per day. Okay, and then go ahead and scroll down. We actually not sure if it showed up in the data yet, but we actually have 6 deaths. We had another one yesterday in Berry County residents. It's pretty evenly divided between males and females, primarily in the white population in Berry County. Okay, go ahead and scroll down a little bit. So a little bit about hospitalizations. You can see the hospitalizations have increased dramatically in October. We're not done with October yet, but at the time that we did this report, we had 14 Berry County residents that had been hospitalized. So you can see how that compares back with April and May. So we're seeing far and away more, which is really what we'd expect given that increase in cases. In terms of age distribution, we're seeing a lot of cases. That's a historical over the entire pandemic numbers, but we're seeing a lot of cases in working age people, so people from 20 to 70, basically. So even though there's a lot of attention on school cases, and we are seeing some school cases, by and large, the transmission's not happening at school, it's happening out in the community. We're seeing a lot of church outbreaks, a lot of workplace outbreaks, a lot of outbreaks from weddings, funerals, other kinds of gatherings where people are getting together. Okay, go ahead and scroll down. I think I was getting ahead of myself there. Yes. So you can see the bottom two colors are kids age 0 to 9 and 10 to 19. So in October, we had very few cases of 0 to 9 and some cases in 10 to 19. But you can see the cases in 30 to 39 are increased dramatically. So this working age parents, basically. Okay, and then go ahead and scroll down, please. Okay, so this is talking about positivity rates. So positivity rates is the percentage of all the tests that were done that were positive. So it's not counting cases or people, it's counting tests. So we look at this for 2 things. One, we're looking at it for testing capacity to see how well we're testing. And what we know is when testing positivity is very high and the number of tests we're doing low, that's really reflecting testing capacity. So if you look back at the beginning of the chart, you see we had positivity rates up to 30, 40%. And that was because we were testing very, very few people. Basically, you had to show up at the hospital very ill in order to get a COVID-19 test. Uh-huh.
Go ahead.
That 180.9, who's administering those tests? Is that the health department?
No, so that would be any test that's being conducted by a laboratory. So it would be those that are done through drive-through testing sites, the ones done at pharmacies, hospitals, other testing locations.
Include that there are 181 tests being done today?
In general, yes. Yeah. Go ahead and scroll down. So here's the actual Berry County daily tests over time. So what this is telling us is from the time of mid-July or so, we really have had a really steady access in Berry County to testing. So we're not seeing an increase in testing in Berry County right now. We're seeing an increase in virus circulating in the community. So if you go scroll back up, so that's what that very tail end is showing us, where testing has been steady, but yet we're seeing an increase in the positivity rate. That's telling us that there's more virus circulating to be found. So I know there's a lot of discussion about we're just testing more, and we are testing an adequate amount, I would say, in Berry County, which is good. So there's a couple places in Hastings to get tested. And we're seeing people go to Kalamazoo and Grand Rapids and other places to get tested pretty frequently. However, we're seeing that positivity increase, and that's, we'd like it to be below 3%. And so right now it's over 6. So that is that. Is it possible for you to switch to the dashboard, please? Yeah. So the other question that we get quite a lot is, how is the virus geographically dispersed across the county? And so what we have, I think, to report is that at the moment it seems to be blanketing the entire county. So if you, well, I gave them the link before, but if you go to barryeatonhealth.org, you can pull it up from there. Yep. And then go ahead and scroll down. Keep going. There's the data table. There's a link that says Interactive Data Dashboard at the very bottom. And it takes a second to load. Okay, so this is showing the number of COVID cases per municipality, so per township or city for Berry County. Below the picture of the map, there is a tab that says Hex Bin Animation. Can you click on that, please?
I'm sorry, where was that again?
It's below the picture of the map. It says Hex Bin Animation.
Again?
Yep. Okay, and then go ahead and click on the play button, please.
You go full screen?
Yeah, there's a little tiny button at the very top right corner of that box, of the map box. Or, yeah.
Oh, there's, no, you were right.
So depending on how good the internet is in here, it should play.
Barry's on the left.
Okay, yeah, so Barry's on the left, and so what you'll see is these brown hexagons are places within the 2 counties that week that had cases. And then every time there's a brown hexagon, essentially it leaves behind a little marker of how many cases were in that particular location. So June, and you'll see that, we have a large concentration in Eaton County and Delta Township. We start seeing more cases in Hastings and Middleville, which is not surprising because a lot of people live there. So here's July and August. We had fairly reasonable case counts. August. And here's when the kids went back to school.
What's the purple box?
The purple is how many cases there are. So it just increases in size, and they also label it a different color. So that's where we are as of October 23rd. So you can see, the geographic distribution of this is in all parts of the county. Certainly concentrated in Hastings, Middleville, and some of the villages, but that's to be expected given the number of people that live there. So I guess I would answer any questions about the data. Otherwise, I'll hand it back over to Colette.
Commissioners, any questions for Ann?
It just seemed to explode right there at the end. Do you have a specific date where it started growing exponentially?
So it really would be about 3 weeks ago
So
in
about 3
Barry.
weeks, okay.
Yeah. And unfortunately, we're already starting to see some of those deaths, which is what we would expect to see.
So if this trend continues, how many fatalities are we looking at in Berry County?
We're seeing about 1 or 2 fatalities a month, but we will, I mean, the more cases we have, the more there will be, unfortunately.
Any other questions for Dave?
And the thought process was that when college got back in session, that it was the college kids that was spreading it, that they were the super spreaders. When I look at this data, it's really working age people, 20 to 50, 20 to 60. The numbers don't indicate that schools are where the source of this is or the spread of this, that this is more gatherings, people getting together, work environment, stuff like that. Is that correct, or am I misinterpreting this?
That's correct. I mean, we have had a number of cases in schools, so that's, it's available for people to look at. We've even had some districts decide to close temporarily for in-person instruction, but that's primarily driven by staff availability. So meaning that they have too many staff in quarantine to really be able to come to work and operate their school. We have not seen the sustained transmission within school buildings that we were really afraid of before they went back. And the reason for that, we think, is many schools are doing exactly what we asked them to do. They're keeping the kids within the classroom setting. They're not moving them around. They are enforcing mask wearing, and they are doing a great job at cleaning. So all of those things are helping school be fairly, I wouldn't say protective, but fairly innocuous when it comes to COVID-19 transmission within the community. So a good way to think about it is the cases we're seeing in schools are a reflection of the cases within the community. So the more cases we have in the community, the more cases we'll have in school. But we're not seeing the schools actually drive community spread. And absolutely, we're seeing working age adults being the primary. Quite often, a parent will get COVID-19 somewhere and bring it home to their family, and it spreads to their children, and then the children go to school.
Okay. And the death rate appears to be relatively flat, that although case counts are up, hospitalizations are going up, death rate still fairly low.
It's hard to say because Barry County is such a small number of people anyway. So when we have a rare event, thankfully like a COVID-19 death, it's really difficult to calculate a rate. So I would say when we see all those hospitalizations, we're going to see more deaths. However, we do know that our medical community is better at treating COVID. So hopefully, as most of those people won't die. But it's hard to say at this point.
Okay. What about hospital capacity at this point in both Berry and Eaton County? How are we doing on capacity?
Our hospital partners across the state are kind of sounding an alarm bell because they're seeing their hospitals start to fill up again. However, we're also seeing less ICU care and more ambulatory care. So a lot of people that have COVID may need some support or treatment, but maybe not in the ICU. So you know, it's hard to say at this point. I don't know that we have a immediate capacity problem within hospitals in Berry or Eaton counties, but we also tend to send many of the very ill COVID patients end up outside Berry and Eaton counties at larger hospitals.
Okay, any update on treatment as far as the virus goes, as far as, you know, just the cure for it at this point? We keep hearing that it's coming, that it's in the pipeline.
So I would say because the medical community has more experience treating COVID, and there's been more time to learn about the virus from a treatment standpoint, they are better at treating it. There's some therapeutics that are available, like remdesivir, and the access to those has increased. In terms of, but those aren't really cures. Those are kind of supportive care. So they're to help somebody's system fight it off, basically. And then we have the vaccine on the other hand, and vaccine, you know, likely coming early next year. And one of the challenges that we will have as public health folks and the medical community really is figuring out how to get the population that wants to be vaccinated. I mean, we've never had a situation where we've vaccinated the entire population all at once. The closest we come to it is flu every year, and it's very hard to get, you know, people to get their flu shots. So yeah, I mean, it's hard to say at this point, but, you know, from a public health perspective and looking at the data, you know, there's a couple, I think, important takeaways. One is, given the amount of virus we're seeing circulating in Berry County, we want to encourage people not to be in large gatherings. So if you have a large gathering, there's a greater chance that there's a person there who has COVID and may be shedding it. And that those are those super spreading type events. So we'd like people to work from home if they can. We'd like them to go to church virtually if they can. We'd like there to be, you know, any sort of socializing people are doing, we'd like that to be outdoors. And we know it's getting colder, but, you know, there's something that seems to work really well at dispersing COVID in terms of being outdoors. So, and obviously mask wearing. Mask wearing has a huge impact on the rates of COVID that we're seeing.
How concerned are you with the next 90 days based on the information you just given us this morning?
So what I will say is, and Colette can talk about this a little bit more, but, you know, our focus is to make sure that people who've been exposed stay home, and there's going to be more and more people exposed, and that makes it harder, I think, from a health department standpoint, to reach all of those people in a timely fashion. So, you know, we're starting to shift our messaging a little bit to say, if you know you were exposed, don't wait for the health department to call you. Go ahead and start self-quarantining so that you can protect other vulnerable people in your community.
Okay. Thank you, Ann.
Yep.
Heather?
Yes, sir.
And what do you think about the testing in Berry County? Are we doing all right? Should we be doing more? What's your thoughts on that?
So I think the testing capacity is much better than it was at the beginning of the pandemic. Spectrum Penic is continuing their testing, which is excellent. And then we also had Family Fair Pharmacy come on board and start offering testing in Hastings. So that has really helped quite a bit. And then we do see a lot of people in Middleville go up to Grand Rapids, and we see people in southern Berry County go to Kalamazoo locations. So, you know, it's probably a little bit more of a drive for people in Berry County to get a test, but it's not too far. And considering that, you know, it's a rural population anyway, we're not super concerned about that. Now, certainly, if we start seeing that testing drop, like it's sort of, if you remember that chart, it was sort of bumping along. If we start seeing that drop, then we would want to take some sort of intervention to increase that back up.
Thank you.
Dan?
Yeah, hi Ann, good
Hi.
to see you, at least part of you. So, I wanted to know of the deaths that are happening and how much of it is underlying reasons too. I get that question all the time, that you know they all had underlying reasons, the ones that died, and how does the thing grab people that don't have underlying?
Absolutely. Yes.
Into the serious illness and death?
Yes.
Okay.
So if you scroll back up, if you don't mind, to the age chart. Okay, so what you'll see is we have 3 deaths of people over the age of 80. We have 1 death of someone 50 to 59, and we have 1 death of someone 20 to 29. So we have people sort of spanning the age range here of where we see deaths. Deaths in the younger age, 20s, 30s, are rare, but absolutely possible with COVID-19. It can overwhelm someone's system very fast. But we also have some deaths in people who are already have complicated health conditions. The important distinction, I think, for these COVID deaths that we're seeing in older adults is that without COVID, they wouldn't have happened, most likely, right then. And so that's where COVID is contributing to their death. And so that's how it ends up on the death certificate and being counted as a COVID-19 death, associated death. Because those individuals may have had diabetes, they may have had lung conditions, or they may have had other complications, but getting COVID pushed them over the edge, essentially. So that's where we're looking at the concept of excess death. So in the world of infectious disease, where getting COVID is preventable to some extent, we're looking at these as essentially excess deaths that if COVID didn't happen, these deaths wouldn't have happened.
Okay, what about the rumor that hospitals call it COVID because they get $15,000 if they from that if they call it COVID? Is it anything there you want to speak of?
Well, so I think it's important to understand when you're looking at death certificates and medical billing and coding, that those things have very specific rules attached to them. So you can't just make things up and put them down and get paid for it. I think the issue with, I can speak more on the issue of death certificates. When you look at the causes of death, the determination is made by the treating physician, so the physician who cared for that individual. And that physician talks about all of the contributing factors of that person's death, and all of those things get coded as associated. And so one of the things that we see very often is they'll code something like cardiomyopathy, meaning heart damage, and then resulting from viral infection, then resulting from COVID. So if you look at a death certificate, it kind of gives you a chain of the causation quite often. And so, if you're not used to looking at death certificates, it looks like, oh, well, they really died of cardiomyopathy, and they did, but the reason for that cardiomyopathy was because of COVID.
Okay, thank you.
In terms of the financial incentive of hospitals, I can say that hospitals, intensive ICU care of COVID-19 individuals is not how hospitals make money. They really don't have an incentive to have lots of COVID patients, for sure.
Thank you.
Are there any other questions for Ann?
The federal government recently made a block grant of rapid testing supplies to the state of Michigan. Has there been any discussion, or can we be ready for a shipment of those here to Berry County?
Jen, would you be able to answer that question?
Can you come up, Jen?
We did receive notification that those tests were going to be made available by the state of Michigan. We have requested a shipment to be sent for Berry and Eaton, and we're looking at how to distribute those across the counties to be able to have access emergently or immediately.
When do you anticipate those tests arriving and the decision being made on how to distribute?
The state has not given us a date of when they will be available. They gave us a final date of last week when to have requests in. They would review and then provide us more data later.
Thank you.
You're welcome.
All right. Colette, did you have something before we settle in with Jen? Make sure that you have the mic as close to you as possible.
Yep.
It's really hard for people back there to hear.
Okay, so I just wanted, now that you've had the context of the data, I just want to give some background on what it's been like in the office for the boots on the ground. The numbers that we've been seeing the last couple of months have, really put a burden and strain on the health department staff. Keeping in mind that in addition to COVID, we have our usual operations that we need to maintain. And so the staff have been pretty overwhelmed. We have staff working 7 days a week. Once again, we've pulled staff off of their usual work to some extent. So some of our environmental health specialists are now once again working COVID. And then staff from other areas of the department are doing the same. And so, we, this is just in an effort to try to keep up on the number of cases coming in. But even that is proving challenging. When we have, over the weekend, one of the days, we had 60 cases come in one day, and it's just not possible to maintain that workload. We're also leveraging the state resources where they're available, so we are able to send some cases to the state to do the investigation. The state is overwhelmed as well, and so as an example, this weekend they, notified health departments, don't send us anymore. We're swamped. And then the contact tracing is the other part of it. Keeping in mind there's sort of two components. There's the positive case or the probable case that has to be investigated, and then there's the notification to all the people that individual potentially exposed. That's the contact tracing part. We already have been using the state system to do that contact tracing. We refer to it as TraceForce, and that system is as well overwhelmed at this point in time. And so whereas earlier on in the summer, for example, individuals who were contacts were being contacted pretty timely within 24 hours and then monitored over the course of their 14-day quarantine, now we're having a difficult time even getting that initial phone call in some situations, and then it would be unusual for somebody to get monitored consistently over that 14-day quarantine at this point. So we're relying on the public to really understand the situation that they're in and take the appropriate precautions, and just where they have questions or concerns, that they be reaching out to us with that. I will tell you that our phone systems are overwhelmed at this point. Staff are having a difficult time keeping up with phone calls. So if you're hearing from constituents who have left messages, let them know leaving the message is still the best way to reach us, because staff are on the phone the vast majority of the day. Those messages do keep building up, and we do try to answer and respond to them in the order that they've come in. And so, but it's a never-ending cycle in that regard. And so then the last thing I would say is that the Board of Health did approve the addition of 3 additional limited-term positions, referred to as disease investigators. So we will be adding 3 positions any day now. We had 3 successful candidates come into play, and so hopefully we'll be adding those to our staff capacity within the next week or so, and getting them on board. And that will hopefully alleviate the stress that staff are under, some of the staff have been working overtime for several weeks now, and they can't maintain that workload. So I do think as we're looking forward into the winter, based on the numbers that we're seeing, that those 3 investigators will help improve our response, but it's not going to fix it. We're still going to have capacity constraints. We still will have to have other staff pulled off of their usual assignments in order to help respond to this situation. And so just what that means is that ripple effect to those other programs and services. There might be delays in our response in those areas as well as we continue to juggle and reprioritize our activities. So I will pause there and see if anyone has questions.
Colette, have you heard of anything from the state coming down on more money for more personnel? Because I don't imagine that we're the only health department doing that. The state must know that all health departments are being taxed.
Correct, yeah. This is not unique to us. It's definitely a trend happening around the entire state. There is no definitive answer on additional funding for post-December 30th. The state does have some additional funding that they will be pushing out to health departments that could use it, but that is funding that must be spent by December 30th. So it helps a little bit, but timing-wise, we're reaching sort of end of life of being able to truly use those dollars. But we will take advantage of those as we can to cover our costs for the remaining time until the end of the year. Nothing definitive for after January 1. I think the hope is that after the election next week that there will be some movement on support to COVID response activities either at the federal or at the state level, and that maybe that will allow us to extend some of these funds into the new calendar year as well.
Thank you. Thank you for what you do, too.
Any other questions for Colette? I think it's Jen's turn.
Thank you.
Thank you for coming in.
Well, I guess they're done. Thank you. Okay. I didn't know if Jen had stuff too. Thank you, thank you, thank you. Sorry we didn't get to you the last time we were here, or you were here. I appreciate all the hard work that you guys are doing. Any other state or county official? Limited public comment. At this time, any member of the public wishing to address the board may do so for up to 3 minutes.
Good morning.
Morning.
Talk as close to the mic as you can, please,
Yes.
sir.
Joel Ibbotson, Rutland Township. I handed out a case to the commissioners this morning that does a pretty good job of putting in cement the county's role in the jail. They are responsible for it. And that is regardless of whether this millage passes or not. As you all are aware, we've recently failed state inspections due to the lack of ability to classify women inmates in addition to a couple other things. However, it was brought to my attention on a phone call with a commissioner that they thought, well, not that they thought, but that particular commissioner thought that it was potentially a possibility for the commissioners to censor the sheriff through means of the budget. And that is impossible. You have to look at the Brownstown Township versus Wayne County Court or case, and that will explain that that is completely impossible. However, Maple Valley News, Johnny Hartwell criticized County Commissioner Ben Geiger for telling local news that the recent controversy surrounding Sheriff Darleaf may have hurt the millage's chances. No, Darleaf did not hurt our chances, Hartwell said. They hurt the information is not out to the citizens. I have to agree with this. This information that we're getting is that this jail is going to cost us $25 million, us the taxpayers. The county's own estimates is this will cost us $42.2 million. This is information that is critical to the taxpayer. We feel like we're not getting the entire story. You guys are sitting on property that you can construct a jail, and it just seems like this is part of a kick the can down the road thing. The commissioners knew that the climate for a millage was not that great in Berry County, considering the history with the school district. And if, or as I might say, when this fails, I think it's time for this county to consider doing what Wexford County did and quit kicking the can down the road. Let's get a jail, let's build it, and let's protect our officers, let's protect the inmates, and let's make sure that Sheriff Leaf can fulfill his responsibilities as the Constitution requires, which means that this board needs to get a jail in Berry County. Thank you.
Any other limited public comment this morning? Hearing none. Does any commissioner have any correspondence to share with the board?
Just for those that didn't see, Bob Nelson of Gun Lake did pass away. He was a member of our Commission on Aging Board and Mental Health Board, and a real good public servant. He will be missed.
Thank you. I do have a letter from Community Action dated October 7th. We are writing to update you on the progress in our CSBG CARES Act fund in your community. CSBG CARES Act funding was designated to support community member needs caused by COVID-19. The pandemic has wreaked havoc on many families in our community and left Michigan residents in our district with an assortment of challenges. Community Action serves 5 counties: Berry, Branch, Calhoun, Kalamazoo, St. Joseph, and South Central Michigan. Since COVID, our agency has received over $5 million in additional revenue to address the various needs and barriers that people have faced by the pandemic. All of the additional revenue received, or of the additional revenue received, the CSBG money has been the most flexible, both in our ability to administer and to actually help citizens in the community. Since mid-April, Community Action has helped 122 unduplicated clients and spent $218,507. We have helped the utility assistance, eviction prevention assistance, burial expense, water assistance, and foreclosure assistance, which includes mortgage and property tax assistance. The other piece of the grant that makes this so beneficial is the administrative burden that has been lifted. Unlike some programs coming from the state level that have outrageous in their onerous restrictions, this grant raised the poverty level qualifiers for assistance from 125% of poverty to 200% of poverty, allowing more families to be served. In addition, the grant requirements reduce the amount of documentation for income verification while still providing accountability and to make sure that there isn't abuse, and provided the flexibility to administer intake services over the phone. This has addressed so many barriers for people who need temporary resources or support to have them survive and remain financially stable in this crisis. Another key component of our program is that we can link clients with other resources in that they need. An example of how Community Action links to other resources has been our ability to receive and distribute masks to the community organizations and clients directly. In our 5-county area, we have distributed a total of 4,710 masks and will continue to provide this important need in the upcoming months. I want to thank you for your service to the community and invite you to refer any constituents that might need assistance to our services. And then there's contact information. So we don't see a lot of Community Action's influence in our community. in other communities, they do Meals on Wheels, senior services, millages and stuff. Here, they are primarily involved with the Early Learning Center down here in the old Ponderosa building. They also have a site out near Thornapple Manor. What is it? I don't really want to, what is that, the name of it?
Oh, I Berry ISD.
Yep, I know it's out by the 911 and Thornapple Manor, and I can't remember her name. She's very well known in the community. It's also a early learning center. So they've done a lot for our community. They help with Walk for Warmth, typically in February, which was not held last year because of COVID. So they're very involved, or at least try to be, and it's nice to see that they're letting us know what they've been doing. So before we get started, would you like to take a break? 5 minutes? Thank you.
Where's he?
What's that?
pretty close. Alrighty. I gotta wait for my clerk.
Test, test.
Are you ready, Pam? Alrighty. Okay.
Madam Chair, it's been brought to my attention by the clerk that our minutes for the 13th are missing a paragraph about the corrections that Commissioner Connor asked for. Commissioner Connor did reach out and ask that they be added in before we approve it. So I would move that we take item A off the consent items and place it under items for consideration.
Is there support?
Support?
Been moved and supported to remove item A out of the consent items. All those in favor, please say aye.
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 Opposed? The item's carried. Commissioner Geiger, can you do consent items, please?
Absolutely. Madam Chair, I move for the approval of the October 20th, 2020 Committee of the Whole meeting minutes, approval of the October 20th, 2020 Committee of the Whole closed session meeting minutes, approval to appoint William J. Sweeney to serve on the Berry County Solid Waste Oversight Committee in the position representing the solid waste industry for a 3-year term that begins on 11/1/2020 and expires on 10/31/2023. Approval to award the carpet replacement bid to Lansing Tile and Mosaic Incorporated at a price of $24,715, which includes an additional amount to carpet the mezzanine. Approval of the Michigan Department of Agriculture Farmland and Open Space Preservation Program applications, more commonly known as PA 116, number 2006 for Donald Johnson in Section 33 of Irving Township. Approval of the Michigan Department of Agriculture Farmland and Open Space Preservation Program, more commonly known as PA 116, number 20-04 and 20-05 for G&H LEAP in Section 7 and 18 of Orangeville Township. Approval of the attached Amendment 2020 monumentation surveyor contracts to reflect the increased compensation amounts for Aero Land Survey, per Article XIX of the contract approved by the Board of Commissioners on February 25, 2020, and approve the individual line item adjustments to the monumentation fund, account number 244, to reflect 2020 approved state grant amount as attached.
Second.
Motion by Geiger, support by Parker to approve the items listed on the consent agenda. Discussion is not allowed and a roll call vote is required. The clerk will call the roll.
Connor, absent. Geiger,
Yes.
Gibson,
Yes.
Jackson,
Yes.
Parker,
Yes.
Smelker,
Yes.
Wing.
Yes. Consent agenda, the consent, I can't talk today. Consent agenda is approved. Presentations, we do not have one. We'll now go into the public hearing for the Berry County proposed 2021 budget with projections for 2022 and 2023.
Madam Chair, I move for approval.
We're in the budget hearing.
Oh, budget hearing?
We need to be
Okay,
in the budget hearing.
okay.
So, Michael?
I'm more than happy to present the budget, although this is an opportunity for the public to provide input. So more appropriate would be that we presented the budget to the board at your committee of the whole. We've advertised it in accordance with the requirements of the Budget and Accounting Act. We have, excuse me, maybe that'll be a little easier. We have placed it on our website and made it available to the public. So again, this would now be an opportunity for the public to provide input if they choose to, for your consideration before you adopt the budget. I'll step away for a minute.
Thank you,
and
sir.
Ask if anybody has any public input.
Is there any public input on the 2021 budget? And I know I need to ask that 3 times. Again, is there any public comment on the 2021 budget? And for the 3rd time. There being no public comment for the 2020 budget, the public hearing is now closed. Items for consideration. Commissioner Gibson.
Yes. Madam Chair, I move approval of transfer and disbursements. Item A, approval of claims in the amount of $101,488.62.
Second.
Moved by Gibson, support by Smelker for the approval of claims in the amount of $101,488.62. The clerk will call the roll, or a discussion, sorry. Now the clerk can call the roll.
Geiger? Yes. Gibson?
Yes.
Jackson?
Yes.
Parker?
Yes.
Smelker?
Yes.
Connor absent. Wing?
Yes, the item is approved.
Item B, adoption of Resolution 20-20 to adopt the 2021 Berry County Budget, General Appropriations Act, and millage.
Second.
Moved by Gibson, support by Parker for the adoption of Resolution 2020 to adopt the 2021 Berry County Budget, General Appropriations Act, and millage. Discussion?
Dan, this is your last budget. Any last comments on it?
It may not be my last budget. Will be.
Oh, yeah. Never say never.
Probably for the county, yes. So.
Yeah.
But
Any other discussion? The clerk will call the roll.
Gibson?
Yes.
Jackson?
Yes.
Parker?
yes.
Smelker?
Yes.
Connor absent. Geiger?
Yes.
Wing?
Yes, the item is approved.
Madam Chair, I move for approval of item A from the consent items.
Second.
It's been
As
moved
amended.
by Gibson, support by Smelker for the approval of the October 13th, 2020 Board of Commissioner meeting minutes. Discussion?
Pam needs to add a paragraph in there. So do you, I guess it's the chair's decision.
Pam, do you want to read what you're adding to the minutes? Or,
It was brought to my attention that the October 6th meeting minutes, Commissioner Connor was not present, and I did not have her marked as absent. So that was approved at the October 13 meeting minutes, and I did not include that paragraph in those minutes.
okay. Any other discussion? Hearing none, the clerk will call the roll.
Jackson?
Yes.
Parker?
Yes.
Smelker?
Yes.
Connor absent. Geiger?
Yes.
Gibson?
Yes.
Wing?
Yes,
Thank
the
you.
item is approved. Unfinished business, we have none. New business, we have none. County Administrator's Report.
Good morning again, thank you. Just a couple of items to report. There are 3 major, I say major, CARES Act programs that the board has applied for and I wanted to report on. The first is the Public Safety Payroll Reimbursement Program. If you'll recall, we applied for almost 800, a little over 800,000 in reimbursement for public safety payroll reimbursement for the months of April and May. After Treasury received all its applications and calculated how much it was able to reimburse compared to the requests, we received just over 50%, 402,900, actually we received 50%, $402,960 of that. Portion of that, about 90,000, went to 911 We've transferred that. And so there is some final reporting that needs to be done. Of course, all of these programs have significant reporting attached to them, and we will meet that requirement. But just confirming with everyone that we did apply, or for the funds we did apply for, we have received 50% of those. There will not be, of course, a second round since there were not enough funds in the first round. So the next program is the hazard premium program. If you'll remember, we applied for, I believe it was 50,000, 52,000 in funds. We did receive the funds. The hazard pay premiums have been paid out to all individuals. They were due to be paid out before September 30th, and that was accomplished. We have met the program reporting requirements so far and are awaiting the state to issue the final program report that needs to be submitted to close that program out. And then the third program is what's called the Coronavirus Relief Local Government, there's another G program, I guess grants. So the Coronavirus Relief Local Government Grants Program. And if you'll recall, that was a program where the state elected not to pay us the August revenue sharing payment. And in exchange for not paying us the August revenue sharing payment, we would receive the Coronavirus Relief Local Government Grant Funds. The amount that we received from the state was $436,502. And that, of course, as well requires some reporting. So we have received the funds. We have filed the necessary initial certifications and are in the process now of providing documentation for those funds and waiting for the final report to be issued from the state so that we can submit that. On the plus side, we are required every year to do a single audit, which is an audit in compliance with federal awards. These will fall under that, so it won't have any additional cost, if you may, associated with our auditing process this year. It will add to that auditing workload because we have some additional funds, but should not add any new standards, if you may. I'd try to answer any questions on any of those if you have them.
Any questions for Michael? Thank you for all the extra paperwork
Yeah, you're welcome.
that we didn't have to do.
Well, that leads me then to. Are you going to give us paperwork? Nope. No. That leads us to then budget amendment. This will require some budget amendments that we'll need to do. We're working on those right now and hope to get those to you in the next board meeting or two. Right now, nothing significant of concern stands out there. We've had some revenues that we were expecting that we're not going to get. The state has offset some of those with CARES Act funds that we're going to get. Long and short is I don't see us, I don't have any concerns at this point with the 2020 budget. I appreciate your adopting the 2021 budget. That's a status quo budget. We did not have to make any cuts at this point. We'll continue to monitor it closely. I don't anticipate having any issues that won't allow us at this point to get through 2021, but some of it is reliant on those state revenues that we receive, and there just isn't good word yet from the state how much of their budget they had to backfill with CARES Act funds, and how much they're going to need to backfill and or will receive in CARES Act funds for 2021. So we'll continue to monitor that closely, but I'm feeling optimistic and pretty comfortable at this point with regard to 2020 as it closes out, as well as 2021. I think we're started in as good a spot as we possibly could be, I think.
Thank you, sir. Moving right along. Chairperson's report. I'd just like to thank you all for understanding while I was away during the last Board of Commissioner meeting. Your prayers and support were definitely felt. My family appreciates you sparing me for the week as well. Vivian is not here for the chairperson's report. I know we are at the end of the month, and she typically has a bunch of meetings and reports. My meetings are done until next week. We start all over right at the beginning of the week, so it'll be very interesting. Volleyball season will come to an end this week, so I'll be able to have my evenings. Only 2 months. Just started in August, so it's been a long 2.5 months. I hate to lie to the lady at the front door when they ask if you have any muscle aches, but being my age and playing volleyball with a bunch of teenagers definitely contributes to muscle aches. I'm very thankful I don't have any broken bones or any serious injuries, because volleyball is not for somebody who's been out of sports for too many years. But it's been a nice activity to be involved with my daughters with. So they have done very well, as has the rest of their teams. Not so hot, but this was a building year. We lost all but one player from last year's squad, at least on the varsity, and so next year looks more promising. I should have about 16 girls between varsity and JV, and I'll have some really nice, a really nice squad there, but we'll be having a rebuilding year for our junior high team. So they've done well, and they've held their own against some pretty tough schools. So I'm very proud of them. Commissioner reports. Commissioner Parker.
Nothing much. I've had some people call and ask me different things about the jail and that. I'm going to be giving out some more pamphlets today at Middleville Rotary Club on the jail. And that's about it. My schedule's kind of been gone since last week, so.
Commissioner Jackson.
All set. Just to reiterate some of the stuff, we did have an emergency meeting with the health department. I was gone for the health board meeting last week, but they, a lot of information, a lot of concern about where the coronavirus is heading right now. So just everybody take that seriously and be safe.
Commissioner Geiger.
The only thing I have is that I will not be here for next week's full meeting.
Fun. Enjoy. Commissioner Smelker.
Went to my townships and gave out my literature that I've received, and about the only committee I went to is 911. They're doing negotiations, and I have the majority of my meetings are coming up yet.
All
Oh,
this
yeah.
week?
Hmm?
All this week? Wow.
Yeah, well, I went to the health department, but they've already reported on that one.
Thank you. And Commissioner Gibson.
Berry County Transit has 5 new buses coming soon. That's all I have, but don't forget to vote and have a happy Halloween.
Thank you, sir. Limited public comment. At this time, any member of the public wishing to address the committee may do so for up to 3 minutes.
Joel Ibbotson, Rutland Township. I wanted to expand a little because my time was running out the last go around. The county's kind of handicapped themselves with looking for a different location, seeing as we recently put $1 million into the Berry County Transit. which effectively negates the option of being able to sell that property to a commercial vendor of some sort. It's committed that road frontage to the county for the next, I would imagine, few years. We've wasted tens of thousands of dollars on Tower Pinkster. The transit's recent improvements mean it would limit the property's very drastically future commercial value, at least our willingness to be able to sell it at that point. This is part of the court case I gave you. They, referring to the Board of Commissioners, have full responsibility for the plan and detail. If they provide a suitable and sufficient jail and keep the same in good repair, no court may properly interfere, even though the court might prefer some other manner of meeting this legislative objective. But upon showing that the commissioners have failed or refused to meet their responsibility under the statute, as it is clearly the situation here, the court can and will direct compliance with whatever specificity is required to achieve the legislature's directive. To rule otherwise would enable local commissioners to thwart the legislative intent by endless foot dragging. I am very against adding an additional tax during a pandemic. I said that several months ago, and that was when the board pushed the millage issue to this election, not the last one. I don't think we're any better situated now to impose a tax on the citizens of Berry County. And I think that the PR throughout this entire thing was horrible, and if it fails, I strongly hope that this board will consider some type of action to fulfill its constitutional duty quickly, rather than kicking this down the road. Thank you.
Any other limited public comment this morning? Hearing none, is there any other business to come before the board? There being no further business and without objection, the board will now adjourn.